you're used to. We wanted to acknowledge a donation today. As many of you remember, just a few weeks back, the tragic incident that took place at Sam's, and quite frankly, an incident that was racially motivated and racially driven in the midst of these times. But what we're going to see today is how a community, even after coming under attack, steps up to the plate, just like you would expect people from the Permian Basin to do in order to show their love and care for our community. So in front of me are big boxes filled with masks and gloves from the Permian Basin Chinese American community. And quite simply, their note just says, "Stay strong, together, we will overcome." And I quite frankly cannot think of a better example and a better encouragement to our city, to our region, to Midland, Odessa, to the entire Permian Basin, that in the hardest of times, in the most difficult times, and even the most personally insulting and injurious times, the community steps up and says, "We want to show you how much we are a part of this community. We want to show you how much we love you, we care for you, and we're doing everything we can to be in this battle with you till we get to the other side." So from the city, and I know from the county and the hospital and the school district and everybody involved, we want to express a heartfelt thanks and gratitude, and quite frankly, a humble thanks to the Permian Basin Chinese American community, and thank them for their gift. And I hope it's an example to all of us of the ongoing sacrifice we're being asked to make, but the reality that we're in this together, and we're only going to win this thing together and not apart, regardless of what has happened to us or what could happen to us. We stand together one day at a time. So thank you to the community, and I would drag you up here and make you take a picture, but I'm not going to do that because I know you don't want to. But thank you very, very much on behalf of all of us. Thank you.
Good morning, everyone. I'm Russell Myers, CEO of Midland Health, and I'm going to lead off today's Unified Command Team briefing. Today is Thursday, April 2nd, 2020. The days of the week are running together, I'm afraid. I'd like to begin by echoing the Mayor's thanks to our Chinese American community. Thank you all very much. You all know that personal protective equipment is a precious resource in this time in the hospital, for our first responders, for all sorts of folks who are taking care of patients, and every donation we get is a tremendous help. Thank you all very much. Lots of other donors have been very generous as well. We continue to see that every day now. Weekdays, our hospital folks are manning a donation center at the Abel Hanger Pavilion on Andrews Highway across the street from the hospital. We continue to get generous donations from all over our community, and once again, thanks. Some numbers to begin with today. Just short of 4,000 cases now confirmed in the state of Texas, and 16 confirmed cases here in Midland County. In Texas, there have been 58 deaths and only one here in Midland County so far. At the hospital, we have a testing site that we've had up and running for several days now. Now have almost 400 tests that we have administered. The results for about 3/4 of those are back. We're still waiting on a little over 100 exams. 13 of our exams have been positive. One of the things we've seen is that as we find successful lab testing facilities that turn around our tests quickly, they begin to get overwhelmed. They perform for everyone, and then the turnaround time slows down. So over the last couple of days, we have seen a slowdown in resulting, and we're hopeful that picks back. Census in the hospital is 117 today. We had only 84 patients in our emergency department yesterday, an extraordinarily low Wednesday, but that's been our pattern over the last couple of weeks. ER traffic is down significantly. In our critical care unit, we have 16 patients. We have now a total of 20 patients who are considered persons under investigation. 10 of those in our critical care space that's separated specifically for COVID patients. 10 more in the medical surgical unit that also is segregated, for a total of 20. When Dr. Wilson comes up in a second, he's going to talk a little bit about a bit of a policy change we have for how we're cohorting patients. That's not necessarily representing a large increase in the number of patients, but rather a change in our classification system that he'll explain in just a moment. Ventilators, always of interest. We have a total of 9 ventilators in use in the hospital. 6 of those are patients who are on the COVID unit, and 3 other patients are on ventilators. A total of 44 standard ventilators are available, so 9 out of 44. Plus we have another supply of 37 disposable or single-use ventilators in addition to those, so we still have an ample supply of ventilators. We've talked a couple of times about employees, those who are being either monitored or quarantined because of some level of exposure. As of today, we have 17 employees to stay home, self-report, self-manage, work with our employee health group to determine when they're safe to return to work. Most of those folks actually were exposed in some other way, or they're being quarantined for some other reason besides exposure to a patient in the hospital. We now have 8 employees who have had some level of exposure but are asymptomatic and are safe to work with a mask and protective equipment. So we continue to monitor each of those employees every day. As I told you, a really significant increase in donations. We've been very blessed. We also have had some of our suppliers finally come through with personal protective equipment. As of yesterday, we're up to 138 days of available N95 respirators at our current use rate. That's about the highest number we've had since this crisis began. Of course, if the use rate goes up, those numbers go down fast, and we continue to be careful in managing access to especially N95s, but all of our personal protective equipment is carefully managed. We've had an update in our management of employees who are traveling. As you've seen, the CDC recommendations for high-risk areas have grown daily, and there are multiple cities now in the U.S., in addition to many international sites that are considered to be high risk. And so we put a rule in place asking our employees, if they have traveled outside of this state in any way to any place, they are to check in with our employee health folks and be monitored for a while, whether they're symptomatic or not. We're just trying to be as cautious as we can with possible exposure. You may have seen a report yesterday from the State Department of State Health Services about a new study that had come out of Singapore where they were seeing evidence that people who are asymptomatic are able to transmit the virus. That's obviously, some of that work is still preliminary. Dr. Wilson may want to talk about it some more, but it's an opportunity for us to reinforce once again the vital importance of social distancing. Just because the person you're in the room with or standing behind at the grocery store isn't exhibiting any symptoms, that doesn't mean that they're not potentially carriers, and the possibility of infecting you or your family is real. Finally, to end my remarks, I'd like to give a little praise and thanks to our environmental services team, the people that clean the hospital throughout the facility, every patient room. These are people who are absolutely on the front lines. They've taken very well to the heightened expectations we have for disinfecting, for cleanliness in the hospital. We've had virtually no housekeeping staff who've called in sick throughout this time period. They're dedicated, showing up every day on the front lines, even training other employees who are not accustomed to doing cleaning work and how best to do cleaning and disinfecting where we have opportunities to use non-EVS personnel. So thank you very, very much to our environmental services team. We're very proud of you, and we couldn't do it without you. A second for questions from me before I call on Dr. Wilson to give a medical update. Yes, sir.
I was reading yesterday that you commented that a portion of the tests that y'all requested for the hospital, not all of them have been able to go through so far, that right now you guys are waiting on a lot more tests that you guys are wanting but don't have access to yet. Can you kind of elaborate a little bit more about that?
The question's about testing availability, and I think there are 2 different answers to that. One is there are 100+ tests that are still outstanding that we've sent off to a remote lab, and they've had difficulty getting those results out. Some of those results are now over a week old, as much as 10 or 11 days old. We continue to talk to them every day about getting those results, but they are so overwhelmed that their backlog is continuing to affect us. The other side of that question is a test that we will be able to run on our own laboratory equipment, so we have control of the whole cycle within our hospital lab. We had ordered about 1,000 of those tests after they were released by the FDA. Unfortunately, we were told yesterday or the day before that we're only going to get about 60 of them, and a good half of those have to be used in the calibration and quality control process. So very, very small numbers of tests available to us that will be available to be run in our own lab. And so that's really not a game-changing number. We remain hopeful that we may get large numbers of those tests available to us in the future, but here in the short run, we'll just have a handful of tests available to use on our own in-house patients, and that really won't change our ability to test in the community.
And I also wanted to ask, what is y'all's plan so far as financing all these tests? Does that mostly fall on the county, the hospital themselves, or the patients and the family?
The question is about financing tests. We have the biggest answer to that is we've been given a generous donation very early in this process by one of our local foundations to finance testing. And so I don't think we have any concern about the cost of testing at this point. We do understand there will be some government support as things go along. We have not taken any payment from patients. We have asked them for their information if they're insured to give us the ability to bill their insurance later if that seems to be appropriate, which remains to be seen depending on governmental funding. But patients have not been asked to pay anything up front for any testing, and we expect that to continue. Okay, thank you all very much. I'm going to call now on Dr. Wilson, our Vice President of Medical Affairs and Chief Medical Officer, to give a medical update.
Russell,
I'm sorry.
ask one question?
I'm sorry. Go ahead.
From our Facebook page, can someone talk about the model UT has come out with about COVID-19?
I can talk about that. Tassa's question from our Facebook watchers is about the model that the UT system, there are a group of social scientists who have been using a model to assess the pattern of the disease progressing through each of 22 or 23 cities in the state of Texas, and a statewide model as well. We received that initial modeling yesterday, and we're still digesting it. But I guess the first statement is thanks for the team at UT Austin, led by Dr. Laurel Myers, who has provided this initial modeling for us as we begin to think about what the worst case scenario looks like, when that worst case scenario might occur. This is the kind of data that will be very useful to us. The data enough to be able to comment on it yet. Give us a couple of days. It will begin to inform some bigger picture planning, probably both here and in Odessa, coordinated together so that we can anticipate how many ICU beds are needed in the worst case scenario, how many inpatient hospital beds. If it's more than we have, how are we going to get those? That's work that's still going on right now, and I hope to be able to comment on that probably next week sometime. I think it'll be a few days before we fully digest it. Thank you. Is that all? Okay, thank you. Dr. Wilson.
Good morning. I'm going to start with what Russell mentioned about with the COVID units and the PUIs and how we're designating them in the hospital currently. So we've had, as Russell alluded to as well, increasing information about the sporadic testing ability or the shedding of the virus in individuals, that asymptomatic carriers might be shedding the virus and exposing others to it. Even people that have the virus may be shedding on one day and not on another day. So there's clarity on there. So our PUI patients that come into the hospital and they're having respiratory difficulties, or anybody who comes to the hospital with respiratory difficulties requiring critical care management, they'll go to the critical care unit. And if we think that they may be a PUI patient, they'll be in the COVID ward of our critical care unit. Medically managed patients that don't require that level of care will be on our COVID medical unit. And when they have their initial COVID test come back, if it's negative, they'll remain there. We have been moving them out and cohorting them, and only if there are no designated positive tests, we're recognizing that that may not be as accurate as we'd like it to be. We don't want to expose any of our staff unnecessarily if we find out later that somebody who was initially negative turns out to be positive. So it's going to increase the numbers over time in those units, and as long as the patient's in the hospital, we're going to be keeping them there for the time being. So we're going to be managing that. We're doing some other preliminary assessment. I think I might have mentioned yesterday also that we're going to do serial testing on a group of patients that are coming into the hospital to see if they're negative on one day, positive on another day, or if we can truly believe that that first day's negative is a true negative and that we're negative throughout, or if we just need to test 2 days in a row. We're just trying to sort that all out for ourselves so we have the best information we have and we protect our population the best we can. A point to that also is this uncertainty about when somebody might be shedding or not shedding. I want to go back to a point we made a day or two ago about masking more regularly, that can help improve the social distancing. So if I'm standing 6 or 7 feet away from somebody and I sneeze, there's water droplets that will spread into the air and they may potentially still be exposed. If I'm masked, it'll dampen that. This is common sense. It's not going to prevent the disease. I hope people recognize that wearing a mask around in the community is not going to avoid getting exposed, but the social distancing piece of that is the most important part that will help decrease the spread of water droplets into the air. I think that's the take-home message from that piece. The last few days I've been hearing increasing information, and I think there's been some questions about convalescent serum antibody testing, more rapid testing availability, and there's a lot of hope associated with that. The American ingenuity is phenomenal, and we're going to get information more readily and more rapidly. The importance of the antibody testing is that we can determine then if somebody's been exposed previously, they've developed immunity, and then those are persons that, in 2 ways that's very helpful. One, their serum can help provide antibodies to another individual. There's this convalescent serum therapy that's being initiated in the United States now. The other way that's really helpful is we can recognize then if somebody's immune, we think, just like a vaccination would provide. So if they're tested and they have antibodies, they're safer in a sense to work. And the more people that develop antibodies, the closer we get to herd immunity, so that in our community there'll be enough people that are no longer infectious so that or unable to spread the virus, and so we can reduce the risk to those that aren't protected. And we hope that with that and with the dampening that goes along with social distancing, et cetera, that we can ride this out, keep it at a slow burn rather than an accelerated burn that we've seen in other parts of the country, and get to the point that we have a vaccination and be able to get everybody protected and put this behind us for once and for all. But all those things are promising, all those things are very helpful, but there's only a singular thing that's going to stop this disease in our community right now, and that's social distancing, shelter at home the best that you can, recognizing that we all have limitations in the ability to do that, but if you have to move out into the community, do it thoughtfully. Stay separated from others. If you go to a store and you see people aren't following that, find another store. The social distancing piece of this is going to protect us more than anything else for the foreseeable future. Think about this one point. If we were able to have 100% social distancing, everybody stayed 10 feet away from anybody else, anybody with the virus was self-isolated until they were symptom-free, we could kill this virus in a month. It can't survive by itself. It needs a host. It only lives in a host for a certain length of time. Then it goes away, and they recover, or they have the healthcare issues that go along with that if they end up in the hospital, that 15%. But in a month, you could shut this thing down. Now, is it possible to have 100% success in social distancing? No, it's not. But the closer we come to that, the better we can do in putting this thing behind us. So everything everyone can do to help us with that, please work on it. That's my spiel. Any questions?
Dr. Wilson, we have one from Facebook. Does the viral load a patient gets in exposure dictate the severity of their case?
There's some thought to that. There are a couple of comments to that. One, it takes a certain viral load to get infected. I mean, if you get a small inoculum, you could not get infected. And the larger the load, the more regularly you're exposed, the higher the risk. But I don't believe there's enough information to say whether or not a specific viral load will make the infection more severe. Because remember how viruses work. They get into the body, they in the lower respiratory tract, and then they insert their genetic material into that cell and basically take over the cell's machinery, killing the cell. So it ultimately produces itself and makes more virus, and then it lyses the cell and goes out into the system and attaches to other cells with all the new little viral particles. So that's it's a phenomenon of viremia, when the cells lyse and it releases more virus. That's when you get spike of fever and you feel sick. And then it attaches to more cells and it gets quiescent for a little while it takes over the machinery, and it recycles like that a few times until we hope we develop an immunity and it goes away. So once you get an inoculum that allows an infection to start, depending on the individual's immune system, their vulnerability to the infection, et cetera, it's going to propagate more or less. And so I think it's got more to do with your own, as a host, how hospitable a host you are versus the viral load that you get to start the infection.
How common is it for a false negative?
That's the comment that we've had over the last several days, and it's really unclear. I'll say this, the preliminary test that we do, the PCR test, is probably very, very accurate if it's got the virus on the swab and you put and you run the test on that viral swab. It probably works 97% of the time, as most of the studies are suggesting. The problem is, are you shedding? Are you getting a good swab? Are you getting it from the right location? There's the data we talked about a little while back. Nasal swabs maybe 63% effective, and so almost a third of the time you'll get a false negative. Yes, sir.
Can you explain a little bit more about how the shedding process works and how your body can may or may not be shedding at the time that you're tested?
No, I don't really think we really understand that. I mean, you heard me commenting there about how they attach the cells and how they move through the body, et cetera. And there's going to be times when viral load available in the respiratory tract, and other times when it's really in the cells doing its machinery to take over, and it remains unclear. There's increasing information about asymptomatic people, so before they've ever been sick, shedding virus. And there's information, as I mentioned before, about patients that on one day might test positive, another day might not. So it's how and why, I wish we knew. All right, thank you.
Good morning. I'm Becky Smith, the nursing supervisor for the health department. I'm filling in for Whitney. As our manager spoke on Tuesday, that we are going to start reporting by numbers only versus by individual cases. So that's what I'm going to speak to you about today. As you're aware, we have 16 total cases in Midland. 10 of those are travel related, 4 of those are close contacts, and 2 of those are by community transmission. I'm going to go, which are the source of exposure. I'm going to go over ages. For 0 to 19, we have 2 cases. 20 to 29, 7. 30 to 39, 2. I am going to skip some ages that we do not have cases. 50 to 59, we have 3. 60 to 69, 2. As far as their medical visit where they were tested, we have 8 that were done by Midland Health's drive-through clinic, 4 that were done by private clinic providers, 3 that were done through the ER, and 1 that was hospitalized. The gender division was is males 9, females 7. As far as their current isolation status, we have 15 that are at home, 0 that are in the hospital, and 1 that was the death. So that equals the 16. As far as the investigation status that is current, we have 15 that are ongoing and 1 that is complete. I will speak a little bit about what Mr. Myers mentioned about just beforehand. We were told yesterday by DSHS on our 4 o'clock conference call to start investigating where they were 48 hours just because they could have exposed someone. So that will be part of our current investigations when we get cases from here on out. Any questions?
And so that information will be included when you guys tell us the confirmed case?
That will be included in our investigation. We will be reporting by numbers unless there is something that we need to report as far as the community. Yes, sir.
Are you saying you haven't been asking people where they've been 48 hours ahead?
We ask where they've been to investigate exposure as far as travel and community, but as far as
But
where
as far as where they've been in this community, you haven't been asking them that?
we do ask them that as far as their possible exposure, but as far as investigating where they were as far as being contagious, the state and the CDC recommended the day of symptoms onward. They told us yesterday to start doing 48 hours ahead. So we were following CDC guidelines. Anything else? Thank you.
I want to take just a second to also say thanks to the Permian Basin Chinese American community. You're a part of our community. What happened was nothing less than a hate crime. It does not represent the community I live in. So thank you for your donation. I want to ask everybody just to be responsible. You're hearing from the medical professionals. You know what this thing's about. I'm still getting a lot of folks hammering at me because I won't issue a stay in place or stay home. We've essentially done that. The state has done that. There are exceptions. We're just not calling it where you're staying at home. But we're asking you, please stay at home. I'm going to give a real quick deal. I said it last time. Instead of me going out being afraid that I'm going to catch this, I'm going out with a mindset that I hope I'm not spreading it. And I would ask everybody to start thinking that way also. I've got a wife who's compromised. I've got a wife who has underlying issues. She lost half of a lung last year to cancer. Everything I do does not impact her with this. So me doing that is helping me not impact you. So I'm going to ask everybody, if I'm going to stay home and do the right thing for the ones I love, I'm going to ask you to do the same things for the ones you love. So, thank you.
Atkins, Chief of Staff, Midland ISD. We want to update you on a couple of things that we have in the works in regards to, first of all, our academic plan. So you've heard us reference throughout this process about different phases of our academic plan. This week we entered phase 2. Next week we are launching into phase 3. And that phase involves us bringing your teacher to you in a virtual platform. So as we move through this, we appreciate your patience. Our teachers are moving into some new territory. Our students are moving into some new territory in this phase of learning. What this will entail is including access to your students' teachers' lessons anytime. We understand that this is there's going to be an asynchronous nature to this virtual platform. This will also provide your student opportunities to reach your teacher via specified office hours that teacher is going to push out through Google Classroom, through that online platform, and also provide opportunities for phone calls as well with students who are reached in that way. So this would be considered a high-tech option, but we also understand that there's a need for low-tech opportunities as well. We will continue to do that. Our website has come along with some information on how you can be supported in this phase, including a transition into the Google Classroom. At this point, we are making sure that we are providing feedback to students. We are now in a situation where we are still not taking grades, but we know that it is important for students to receive that feedback in order to drive instruction. So that specific student feedback and performance monitoring is what we are moving towards. I know there's different thoughts about grades and things of that nature, but given the disparities with technology access in homes, it is not fair for all of our students to be treated exactly the same in that regards. But feedback is something that we will certainly continue to provide and move forward with. as well as performance monitoring. With that, we understand there's a need for learning technology. Not all of our students have devices, and while they may have online access, we understand that not all our students have devices. So with that, we are going to be ordering 1,000 hotspots. Those are in high demand, so we're actively working on those. Pushing out Wi-Fi enabled buses into parts of our community that we know have less access to Wi-Fi. More information about that is on our website, and we'll be providing that, continuing to update our website in the future. We have information on that website about different resources for online access. We have a number of companies that provide, give you up to 60 days of online service through several internet providers. So we invite you to check that out on our resources link under the midlandisd.net/COVID-19. We're continuing to update that daily, so please use that as a source of information. We also, we are going to be working with our teachers and our principals to set up a opportunity for students to collect Wi-Fi or their devices through school. This is going to be a very calculated and strategic process, so your principal will have that information in the coming days, so that we can organize that in a very informed manner, and so that we're not moving forward with a bunch of people rushing up to the school at one time. It's going to be a very careful, calculated process. So your principals are in the process of devising that, and that will be shared with you very, very soon. We also want to talk about some mental health resources. So we realize that this is a difficult time for everyone in the community, and we want to be responsive to that and add that layer of support. So with that, we are going to have an opportunity for a mental health support hotline. Callers who call into that line will be able to contact a Midlands ISD counselor between the hours of 7 a.m. and 7 p.m. That is not operational yet, but it will be coming, and once that is available, we're going to be pushing that out through our social media, through our website, and a number of other ways. So we want you to be aware that that is coming. We also, the Midland ISD counselors will be able to help support students with any questions that they're having related to school, community resources, feelings that they're working through at that point in time. We also want to make the community aware that Permia counselors, who are trained crisis counselors, are available to anybody in the community at all times, any time of the day, any day of the week. That number is 1-877-420-962, and that service is completely free. We want to also make you aware that we are working very hard to make sure that we are reaching all of our community. So we launched our first Spanish language Facebook Live last night, and so we were excited for that. We reached 11,500 viewers throughout that process. We're working on some questions. I know that they're still in the works on the class of 2020. So we are going to be adding to our COVID-19 section of our website a section dedicated just to our seniors in regards to questions about prom, graduation, top 10%, and things of that nature. Our principals are working right now very closely on finalizing some of those decisions, and that information will be available on that website. And so we will keep you apprised of that information as that is moving forward. As I know there are many questions and many answers are wanted at this point in time. We understand that, we're being responsive to that, and we're working forward to provide that through that platform as well. With that, I'll take any questions you may have for Midland ISD. Yes, sir.
Will grades be a part of this phase 3 rollout?
No, we are still not in grades right now. At this point in time, we recognize that even though we'll be providing devices for students and on a checkout basis, we have some inequities and some disparities in homes, and so we're moving forward and providing very careful feedback to students and continuing to progress monitor, but it won't be the continuous grades that we've seen in the past. Yes, sir.
How do you determine progression into next grade levels if you don't have grades for almost a third of the school year?
Right. We're working with TEA also to make sure that we're consistent with their guidance through that. So at this point in time, we're not continuing. The grades that we have in point, that's what we're going to be working with. We understand that there are students who are still also from prior to spring break, there were still some students who had maybe some outstanding work and things of that nature that we're going to be working with those students on a case-by-case basis with, but we want to make sure that our process are consistent with what TEA is putting out and that we're working forward with the state in that regard. Yes, sir.
Had a comment from a person on a PTA Zoom meeting that was held yesterday, and the comment is the number of kids who have not been able to be reached is
right.
Your reaction to that?
So the number of students that are not able, so we have something in place right now where our principals and our teachers are calling those individual students. So we are doing it by case basis on every single student. So making sure if for some reason we are not able to reach those students by phone, our principals are working together with their executive directors on other options on how to reach those students. We want to make sure that we want to know where they've gone, what's going on with them, and so if it's not through phone, then our principals are looking at some other options as well, while also maintaining that physical distancing.
You're even not even reaching them. What's to say they're even doing any of the work? Which is to say, how do we prepare them for the next grade period?
And yes, we understand that is certainly a real concern. You know, if we're not able to get in touch with students, then how do we know where they are with their progress in that regard? And so that's something that our principals, that's what we did talk about yesterday, is about the number of students that we're still wanting to get into further contact with. And so we're going to have to go a little bit even deeper into some of those areas. So yes, we are still having those things in the works, but what that's going to look for each student is going to look a little bit different because we're, again, still trying to maintain that social distancing, that physical distancing. Making home visits may not be the thing to do, so we need to find out where those students are at that point in time. So we realize this is a system that is will continue to evolve. Making sure that we're contacting those parents, those students, is something that we're working towards. But if we find that we don't have a working phone number for them, then we're going to have to see another way. How can we find out where those students are?
Last question.
Yes, sir.
Thank you for your time.
Sure.
Why not just call off school now?
So that is something that we're making sure that we're consistent with Governor Abbott's orders right now. So right now he said schools may not start prior to May 4th. That's something we're continuing to monitor, and that's something that we are also making sure that we are working together with this team as well. I know there are different feelings on that. Some people feel like, okay, it's good to have a date to aim towards. Some say, let's just call it. So I understand both sides to the coin. I think that's something we want to make sure that we're consistent with other entities as well, including our Texas Education Agency and our governor as well. So,
but MISD doesn't have an opinion on this right now?
Right now, I can't opinion on this right now because right now we're working forward with moving forward and be cooperative with the governor's order, and that's where we are at this point in time. Thank you. Any further questions for Midland ISD? Thank you.
Well, thank you all again for being here. I first of all just want to start off reminding you of everything you've just heard from every entity, which is for over a month now, or a month, we've been spinning around in a circle of uncertainty, of adjustment, of stress, of trying to figure out what else we're going to do, waking up the next morning to new data, trying to figure out what the safest thing is to do. And quite frankly, I think like everybody else in this room, myself included, if anybody didn't say they'd almost reached their stress level at some particular point, then you're probably not connected to what's going on. I was just sort of looking down at my calendar, and I think it was March 6th, the morning I woke up, to you better drive back to Midland now, and that's the way everybody's been. And now as we continue to see layoffs, as we see more layoffs coming, as we see more and more small businesses trying to navigate the new waters that are related to what the governor's doing and then what we have to do as a city, when you have small business owners in a panic because they've run out of hand sanitizer, and so now when their distributor can't get hand sanitizer to them for 3 weeks, are they now going to close their business? How are they going to do this? Or they're a business of four. It's a 4-generation restaurant. What are they going to do? And so we are all in to say the word uncharted territory would be the greatest understatement I think ever imagine. And so we're all still adjusting, and as you heard just a minute ago, that even if we did 100% social distancing, at best, we're a month from killing what we're staring at, what we're dealing with. So we're going to have to take a little bit of time here to realize this is not going to be over this week. This is not going to be over next week. That we're still going to have to figure out how to hunker down for a battle that's going to take us an entire month. And so as I just sort of go through some things I had prepared for you, as a city council, we made even more adjustments this past Tuesday. We tried to give some consistency to what local retailers could do. We made sure we were in line with what the governor was telling us to do. But the fact of the matter is, all that does for us right now is have even more questions about whether or not someone's an essential business or not, even more questions about how many people we can have in our store, even more questions about how many people can stand outside. And I just simply wrote in my notes, every declaration and proclamation to promote and practice social distancing is a hardship, and every single one of them is not going to be accepted well, and every single one of them is going to create more decisions and more hardship. Every single one of them are going to be difficult. And come next Tuesday as a city council, when we see what other council members might want to do, I think we've gone about as far as we can go, along with the state, in infringing upon every civil liberty that we possibly can infringe upon. The reason I say that is because it still goes down to one simple thing, and you've heard it from every single person. If we as individuals do not take the personal responsibility to practice social distancing, it doesn't matter what the state does. It doesn't matter what the city does. Every single one of us have to finally settle down. If you haven't settled down in the last month, we have to settle down to a place where we say, I'm going to do the right thing, that I'm going to stay home and stay safe. That even if the city put up a piece of paper that said shelter in place, you're still going to have to do the right thing, because you're not going to be able to stay in your house for more than a couple of days. Someone's still going to have to get out and get some groceries. Someone's still going to have to go see a doctor. Someone's still going to have to do certain things. And we are not going to become a police state and a police city. We're not going to have our police driving around the city trying to figure out who to ticket because they're 5 feet apart, not 6 feet apart. That's for you to do. That's for each and every one of us to understand that the high call we have right now in our lives is to support one another, to encourage one another, to understand that every single taxing entity here, every single person involved with the school district who is doing an amazing job with the resources they have, everybody is doing everything they can, but at some particular point, every point is moot unless you and I practice social distancing and we keep trying to figure out what the right thing is to do, and we keep doing it together, and we keep working towards a day when we can start getting back to a new normal, which is our unrestricted freedom that we enjoy so much. Bottom line is, as you're going to hear Mayor Turner say in Odessa, and you're going to hear me say, it's very simple. Just stay home and stay safe. Just stay home and stay safe. It doesn't matter what else we say from this point on. You know the right thing to do. Everybody knows to wash their hands. Everybody knows to stay socially distant. And also, everybody ought to know we're in this together. It is highly frustrating for all of us. So the only way we're going to get through this together without getting mad at each other all the time is to learn how to serve each other through this process. In exactly the same way the Chinese Association has shown us to step up to the plate and serve one another regardless of what it takes, and do what's necessary so we can get a month down this road and we can all look back and have a big poster one day that says, we overreacted. The absolute best thing that we could possibly do is to get to this place as a city where we say, we overreacted so bad, look at how good it was, and then we'll be ready for the next challenge that faces us. Any questions? Yes, Stuart?
The city's been very proactive in talking to certain businesses about their best practices. Has there been any conversations with apartment complexes who, quite frankly, got rich off this community? Yesterday was rent day for a lot of people, and have there been any conversations about asking them to give people in Midland a break?
We have not had direct conversations. I know the city staff is working on what some of our options might be, and I think the chamber has been encouraging those apartment complexes to consider what they're going to help those people. And that's, quite frankly, I had a conversation with someone yesterday who was asking me about a particular social distancing thing they didn't agree with, and I simply responded that I'd be happy to send them all the emails of people who are trying to figure out how they're going to make it right now. In fact, it's probably a 10 right now of how many people are trying to figure out, I can't pay rent, I don't know where to go, I've lost my job, and there's nowhere else in the country for me to go. And so it's a heavy burden on all of us in this city, and it's coming down even heavier every day.
Since the city moved on to that 10% capacity rule, have you noticed any significant difference between the way businesses operate now? Do you think it's made an improvement over in the city?
I think it's a little too early to tell. Quite frankly, I'm not sure that our business is doing a bad job. The difficulty we had, and the reason we had such a debate about it on Tuesday, was we had no standard that we could go by, whether it was the governor's standard, New York standard, our standard. So the reason I came to the 10% on Tuesday was talking to retailers saying, how can we make this fair across the board? Because quite frankly, when you allow 50 people into a Walmart, you end up with 400 outside, and everything we're trying to combat with social distancing goes down the toilet whenever people are wrapped around Walmart twice. And so we'll wait and see. The biggest test for us will always be what happens on the weekends around here. The greatest sacrifice we have to make here in Midland is usually not what's happening Monday through Friday. It's what happens Saturday morning when we act like from the coronavirus. So really, next week, I'll be able to answer that question when we drive around and see how people are doing. But I would say, by and large, all of our retailers are doing the best they can. They're trying to protect their business. They're trying to protect their employees. I think about the people who are stocking grocery shelves at night, and everybody who's sacrificing so we can do the things that we need to do. I think everybody's doing as good as you would expect and making great sacrifices. Thank you all.